Good afternoon, everyone, and good evening if you're in another time zone. We are so happy to offer you our webinar, which is entitled Surrogacy in the Time of COVID, a very timely webinar. I am Diane Hinson. I am the owner and founder of Creative Family Connections, and we are co-hosting this webinar with San Diego Fertility Center. We have with us Dr. Daneshmand, who is reproductive endocrinologist there, and you'll be hearing from him today. We also have with us a gestational carrier, Carrie Jordan, who has gone through a journey with San Diego Fertility as well as Creative Family Connections. And in fact, she is very pregnant. She is due in just a few weeks. So hopefully she won't need to get up and run anywhere. But this is her second journey with us, and we are thrilled that she is with us this afternoon. We also have with us Justin Bernstein. He just recently finished his journey, and he is now back home with his husband and his baby, who is a doll. And of course, I only got to see her virtually, but he also went through his journey with San Diego and with Creative Family Connections, and he'll be able to give you the perspective of having a delivery in the time of COVID. And we have with us our very own Niki Renslow. She is the Senior Manager of Surrogate Recruiting and Matching at Creative Family Connections. So she's going to speak a little bit about the task of finding our surrogates during this challenging time and finding these people who we call our frontline responders. So we're going to jump right into it. And really what we're hoping today to do is to present you with the true life experiences of those who've been through it, and hopefully alleviate some fears and bring you hope and encouragement to prospective parents who have this dream of building a family. And we also, I think, have parents who are at the early stages of their journey, or even maybe the middle of their journey, but never thought that this new phenomenon would be out there that affects their journey in so many different ways. We're going to talk about the medical issues, both about how clinics are now moving forward with the IVF process and what is known about how it impacts or doesn't impact the pregnancy and the delivery. We're going to talk about CFC recruiting and how it's adapted and how we're recruiting surrogates. We're going to talk about steps that we as an agency take to protect our clients and patients during travel, screening, and the embryo transfer, which also Dr. Daneshmand is going to touch on specifically at his clinic. And then we'll give you those two real life experiences that Carrie is experiencing as we speak, and Justin is so fresh in his mind, he'll be able to talk about. And we're going to turn to Dr. Daneshmand, who has been really impressed me as one of the doctors we work with who stayed right on top of COVID and all of its developments. And as many of you may know who have been involved in it, the ASRM and a lot of local health regulations paused all the IVF treatments due to COVID in mid-March when stay-at-home orders first went into effect. But they started to reopen. So can you talk to us a little bit about that? Dr. Daneshmand, are you open fully for screening, and what protocols have been put into place to keep everybody safe?
Absolutely. It's an honor to be here to join the great team at Creative Family Connections, and really also inspired by Justin and his husband and their newborn. We get to follow their little one and really be inspired by their journey as well. So when there was an initial sort of outbreak back in December and January, and that particular outbreak of COVID-19 led to the pandemic that we see now, there were some question marks as to what potential effects this could have on the fertility journey, what potential effects it could have on the pregnancy. So now, many, many months later, there have been many studies that have been published, and these particular studies, the overwhelming majority of the studies have been very reassuring as it relates to pregnancy. Because of the initial unknown, the American Society of Reproductive Medicine decided that they were going to recommend a pause in fertility treatment, including surrogate screening, including embryo transfers. And this happened in March, in fact, with a particular guideline that was published on March 17th. We were getting updates from the American Society of Reproductive Medicine every 2 weeks, including updates from the European Society of Reproductive Medicine as well. And towards the latter part of April, April 24th, in fact, because there were more studies that were reassuring as it relates to fertility and COVID-19 and pregnancy, the American Society of Reproductive Medicine issued guidelines for fertility centers, essentially giving them the green light to continue or to resume operations, including embryo transfers, including screening of surrogates and IVF cycles. So starting in May, we resumed all activities with the exception of embryo transfers, and from the beginning of June, we resumed embryo transfers. It's important to note that within those guidelines were very strict health and sanitizing measures, meaning that the same way we used to see patients at the office is not in progress right now. We have distanced the time intervals between seeing patients at the office. We have actually hired one person whose only job is to sanitize the surfaces. In fact, sometimes when I put the chart down on a particular surface, I got to be careful because it's still drying from the Lysol sanitization. The other issue is every person that enters the office has to go through 3 steps, including sanitizing the hands, filling out a particular questionnaire, getting their temperature checked, and then placing a mask. If they don't have a mask, then one is provided for them. So everyone, including all team members, have a mask. In fact, I got mine right here. So the only time I'm not wearing a mask is when I'm in my office alone. Now, let me tell you a little bit about the studies that have been published. And these studies have been published in very reputable journals such as The Lancet and the New England Journal of Medicine. There is no evidence that COVID-19 or any coronavirus or adenoviruses that cause the flu and other cold symptoms can be transmitted via sperm or eggs or embryos in the process of in vitro fertilization. We have very strict washing techniques and preparation techniques for the sperm, preparation techniques for the eggs that prevent any transmission of actually any virus. That's not just particularly coronavirus, but any virus. That includes hepatitis virus and other viruses in the creation of embryos. So we feel very safe in terms of moving forward with IVF. We have instituted universal COVID-19 screening for all patients going through IVF cycles, including all egg donors. And I'm actually somewhat surprised, but happy to report that of the several hundred patients that have gone through IVF at the time when we started resumption of IVF cycles, we haven't had a single patient that has tested positive. But that is mandatory, and if the test is positive at the time of initiation of IVF cycle, that IVF cycle is canceled. The patient has to go through a quarantine period and then has to have retesting and antibody testing before they can resume IVF. So that's one issue. In regards to embryo transfer, some of the concerns that you have been, well, what if my surrogate is pregnant? What if patients are pregnant? What kind of effect does that have if they were to get infected with COVID-19? Several major studies published show that there's no evidence of vertical transmission of the virus. That means transmission of the virus from the pregnant patient, from the surrogate to the fetus via the placenta. This is not like Zika, where there we see fetal malformations and effects on different organs. So that's really good news, and that's something that's not only the case with this coronavirus, what we call SARS-CoV-2, but it's also the case with other coronaviruses, the influenza virus. So we were very confident in that regard. The other study was one that was published via Columbia University in New York, and in fact, it was published in the midst of a terrible epidemic of the virus in New York City. And Columbia University now has universal screening for all pregnant patients. And what they found was that about 88% of patients who were pregnant, who tested positive for COVID-19, either had no symptoms or had mild symptoms. And the percentage of patients that went on to have severe symptoms from COVID-19 was no different than the general population. One of the areas that we were concerned about is that maybe pregnant patients, pregnant surrogates, such as Carrie, were going to be more prone to contracting the virus, and if they did, they were more prone to having severe symptoms. And that Columbia University study and subsequent studies published in the New England Journal of Medicine showed that that was not the case. So we feel reassured from that respect. Many people believe that during pregnancy, someone's immunity is compromised. It's actually not compromised. All that happens is that the immunity in pregnancy is altered. There is a alteration of a hormone, or not hormone, but a immune cell called a T helper cell, and that just changes, the composition changes during pregnancy. So far, the studies have been very reassuring. We continue, obviously, to recommend for all pregnant patients to take all the precautions, to sort of avoid any large gatherings, wear masks in all public places, try to kind of limit their outdoor activities as much as possible, and take all the health measures. Now, some of you may have heard or know that there may have been some resurgence of some cases in some of the states in the United States, including in places like Florida and Texas. However, the recent studies, at least, have shown an uptick in the number of positive cases, but not a significant increase in the number of hospitalizations, which again is good and may mean that this sort of continued initial surge, or potentially a second surge in the virus, may be affecting more of the younger population, which is less prone to having severe symptoms. Time will only tell. From the onset of someone contracting the virus at a time when they may have severe symptoms could be several weeks, so we still have to follow the data very closely. And we are following the data not only on the pockets of surges of COVID-19, but also on the development of the vaccine, which we believe will be available sometime in probably October. The Oxford University group is well ahead at this particular point with the vaccine. And then there are also some wonderful companies and research organizations, academic universities here in Europe, all around the world, in Australia, that are really laser focused on developing a vaccine. So we're very, very positive in terms of, and very optimistic in terms of developing a vaccine, which then would really increase the confidence for everyone to be able to gradually resume sort of the normalcy of their life. A little bit of
it. Yeah, no, thank you for that. I have so the question that I want to ask Dr. Daneshmand, or Dr. D, as he's affectionately called by his patients and colleagues, is what you're doing for your patients in terms of their ability to give you their the men to give you their sperm and to create the embryos. And since we have 2/3 of our listeners are in the US, but we also have 1/3 who are in Europe, and we've got all these travel restrictions right now, both outgoing and incoming. How are you dealing with that?
That's a great question, actually. It's really has been wonderful to reconnect or continue to have conversations with colleagues in Europe that we've known for many, many years. As you may know, we do a lot of research. We published many papers in the field of IVF that we believe have contributed to the safety of IVF, and also by the research and publications, we've been able to increase the success rates of IVF. But that also has connected us with many colleagues in Europe. And starting sometime in March, that was sort of a personal project for me to reconnect with some of these colleagues around the world, including not just in Europe, but in Australia, in Canada, and develop a very strict protocol for freezing sperm in those particular countries and then transporting the sperm over to us. I'm happy to say that that is now in place. We've already had intended parents freeze their sperm in several European countries, in several cities, and we'll be happy to provide wherever you live. We can provide you the closest city where you can actually freeze your sperm, perform the FDA testing, and transport the sperm in a safe, effective manner over to us in the lab so that you can continue, if you wish, with your journey. We can create the embryos for you once you select your egg donor. And again, that's been a great option, and actually may end up being an option for many intended parents, even once we sort of once the travel restrictions ease. It may be an option that may be attractive for many intended parents. So this collaboration is wonderful. Also, our colleagues are freezing the sperm in the same protocol, in the same manner, very strict. One of our colleagues, for example, is a professor at Harvard University, very well known in Europe for his work, for his research. He has a lab that is, the specialty essentially is sperm analysis, sperm DNA analysis, sperm freezing, essentially finding ways in which we can improve the quality of the sperm and also extract the best quality sperm for the field of IVF. And so we're very happy, for example, honored, frankly, to be able to work with such a great researcher and colleague. And he's doing he's one of the centers that is performing the sperm freeze for us.
That's fantastic to know, because I do get that question from our intended parents, and we are an integrated surrogacy agency and law firm. So a lot of what we've been doing is spending a lot of time making sure that our clients who live in Europe can get here for the birth of their child, under the exception to the travel ban for parents of US citizens. Carrie can attest to that right now since her dad just made it over. But there is no exception just to give your embryo, or if you're a couple, or to give your sperm. So having an option, and you're right, it may become the new normal. I mean, there's a lot of ways of business that we're learning can be done, that are done. So that's really interesting. So speaking of that, let's turn to how COVID is affecting the agency and the legal process, and some of that may become things that we adapt and adopt on a going forward basis. So first, I'm going to turn to Niki Renslow, who, as I mentioned, is the head of our surrogate recruiting and matching team. And so the first question, of course, that people ask is, are we still recruiting surrogates? And most importantly, are surrogates still applying?
Yeah. So great question, Dee. Of course. So we're absolutely still recruiting. We've been recruiting the entire time. I can tell you I'm here in upstate New York, and we were as closed can be, and we're still recruiting you as soon as you apply. In the beginning, I do think there was a little bit of a slowdown, but I think that came more or less with the uncertainty of exactly how COVID was going to develop. Travel was obviously a big thing that I know a lot of people were worried about, and really just kind of trying to figure out their lives. As you know, a lot of people lost jobs, homes. So a lot has kind of gone on. But I think I don't want to say COVID relaxed, but as the state started opening up again, I think people felt a little bit more confident, and we've actually seen an influx of applications, which is wonderful. Obviously, there's so many intended parents who need those surrogates to have those little babies. So we love it. And we're absolutely onboarding, and we've tweaked our process a little bit to make it, as I would like to call, COVID friendly. So before, we used to, if you know anyone at CFC who did the onboarding process, we would travel a lot to go do in-homes and visit the surrogate and her spouse if she was married, or her partner, in their homes. And our team was doing maybe 3, 4, 5 in-homes a month, which, flying right now, yes, we know that's okay, but it's kind of hard to do during these times, especially when restrictions come and go. So one thing that we've started doing is our in-home interviews via Zoom video conference. And, I like to say for the surrogate and for the intended parents, it's very reassuring to be able to say that we've still been able to do that in home and look into the home and make sure that it's a clean, safe, secure living environment that you're going to carry the baby in, or your baby will be carried in. We make sure that they go outside and show us the address of the home. So obviously we know this is their residence, and tour the homes. And I've had some really fun ones. A lot of spouses, I've had a husband in particular who acted like he was HGTV, and he was giving me the tour and he was really into it. I loved it. It was so fun. And so we're still able to interact and have that connection, even though we're not with you in person. It's still very personable, and we're still able to have that connection, which is really, really important and nice. One thing that we have found that's been a little bit easier in our process, and we found actually a lot of journeys are really appreciating this, is before we used to complete medical screening and psych before you would go into your contract phase as an intended parent and a surrogate. So we've kind of tweaked that a little bit, especially now that psych is something that is able to be done virtually because it's telehealth, which is really, really nice. So what we're able to do are do contracts after psych screen and before medical screening to make sure that you have that reassurance, that legal reassurance with the COVID language, and everybody's on the same page before you travel to your medical screening, if it is a clinic that you are going to need to fly to for your screening. You may be matched with intended parents who have a local clinic near you, but either way you still need to travel. So it's nice to know that we kind of get the legal process finished before you're really moving forward with that travel. It's just something else that we find has been very reassuring and has been appreciative on both sides of the journey. So our matching and recruiting team works very closely with legal. So our legal team is on all of our matching calls when we're looking at matching intended parents to prospective gestational carrier candidates. So what we have been trying to do is either match, obviously legally, to a surrogate who may be closer to your clinic or closer to you. Our goal is to make it as easy and smooth as possible for the journey, whether it's, her needing to travel to the clinic for the screening and the transfer and trying to keep her closer there, or to be near you. So you don't need to travel as far when you want to go visit your gestational carrier and be there. Oh, excuse me, for those very important steps. You want to be there for that ultrasound and and see your little one. And if you don't know the gender, that gender reveal is always really exciting. And to be able to spend that time with her and her family, it's very important throughout the process to have that communication and to be with your carrier in person. So that's one thing we are definitely trying our best to do. Sometimes it doesn't happen. We might find you a carrier who will need to fly, and that's okay. But we're definitely going to want to make sure that she's comfortable traveling, her spouse is comfortable traveling, again, to make sure that your journey goes as flawlessly and as smoothly as possible. Our goal is just to make everybody comfortable here. And I can say our case managers have been doing a wonderful job when it comes to the journeys and navigating COVID. And, you really have your case manager hand holding you, which is really nice, updating you. So this is what's going on with COVID today. This is how it may or may not affect your journey. So I definitely think keeping you in the know and being transparent is very important as well. And you'll definitely get that hand holding and reassurance.
Yeah, thank you, Niki. And let me add that your case manager is going to facilitate the journey for both the intended parents and the surrogate. From a legal perspective, we're very clear that we represent the intended parents and that the surrogate will have her own lawyer. And that's just something she deserves. She deserves to have somebody who represents her in reviewing the contract. And we actually require and the parents pay for that and keep a certain sum of money set aside so that if the surrogate has any questions during the process, she has somebody she can go back to and ask questions who's really her lawyer. And that's just in fairness, and so that there isn't any conflict of interest. Sometimes surrogates will say to me, I don't need my own lawyer. And I just say, yes, you really do. It's just for your protection. And, thank you for thinking that way. But, yes, you do. We have been putting in provisions that are specific to COVID. And one of them is something that Niki just alluded to, which is that both parties are feeling comfortable. So we want both the intended parents and the surrogate and her spouse, if she has one, to feel comfortable about moving forward, whether it's moving forward in the screening and the transfer or travel. Everyone has to feel good about it. It's you really are a team about that. And so that's one of the things that our contract says. We put in things about managing as expectation assumption of the risks. So the surrogate has always assumed the risks of pregnancy, and now that includes COVID as well. But similarly, the intended parents are assuming the risk that the baby may or may not contract COVID, because the baby could get it in the hospital. And so the idea is that nobody's pointing the finger at each other. This is a team effort. And so we don't really want anybody putting blame on the other party. And that's how our contracts are really designed to make that clear. We do have some do's and don'ts, and that's that, the surrogate and the surrogate's significant other or spouse are going to agree that they'll wear masks if they're out in public or could be near people. And essentially they're going to abide by the CDC guidelines or the local guidelines. We say if there's a conflict, whichever ones are stricter, because that's going to just make everyone feel safest and abide by social distancing. And honestly, we have not had any issues with that. Our surrogates are of a mindset that they want to know that they've done everything they can to keep this baby safe. So they are an amazing, amazing women, and Carrie is here as a testament to that fact. And so with that, let's turn to Carrie Jordan, who is a 2-time surrogate, and she has her induction scheduled on July 6th. Her intended dad is from the UK, so she started off in a normal world, or somewhere else our world can be, and it all switched on her in March. And she did a journey before that, wasn't going to be a delivery in COVID. So she has the real contrast that she can speak of, and she lives in Oregon. What is it like to be pregnant during COVID-19 and attending doctor appointments during all this? And just tell us a little bit about your experience with it.
Okay. So in mid-March, when everything started shutting down in Oregon, and I didn't know much about it, I at first was nervous. But a lot of like what Dr. D had said, I had conversations with my OB, and I felt really reassured after talking to him that I wasn't at an increased risk for contracting it. And my appointments, they changed in that I had to start checking in from my car. So I would call from my car instead of going into the lobby. And then a nurse would call me when they were ready for me to come in. We do the temperature check, wear a mask. And then I had to start coming to my appointments alone. But other than that, that's how my appointments went. And I guess I just felt that even though the protocols were different than any of my other pregnancies, I just felt reassured that the doctor's office was doing everything just to keep, everyone safe. So I was good with that.
Great. And how are you feeling about your upcoming delivery at this time?
I'm feeling pretty confident and secure. Again, I've had a lot of conversations with my OB, my case manager at Creative Family Connections. I feel like I know what to expect. And again, it's going to look different, but going in knowing what to expect. I have an induction date set for July 6th, but I'll go in on July 3rd and have a COVID test done. If I go into labor before that, they said they'll just do a test, just come to my car and we'll do a test. I know that at this point, it will be my husband and my intended father who will be allowed to be in the delivery room. And so again, it looks a little different. Our original plan was that my intended parent or intended father, his partner, his mom, my husband, we were all going to be in the delivery room, and that's changed. But we're really happy that my intended father made it here from the UK, and I'm happy that my husband will be able to be there, and obviously understand why it can only be the people who, you know, those two in there in the delivery room. And then I'm just again reassured my OB is the same one who delivered my own children and my first surrogate baby, and so that feels good too, and you know, just again reassuring. So I feel pretty confident going into delivery.
That's great. That's great. And you know, I can just comment on that, that one of the things we do is we do a birth plan with the hospital. The case manager does one. And so where we talk about, you know, who's going to be there, who's going to make the medical decisions with respect to the baby as opposed to the, you know, surrogate. And so this is something since COVID that our case managers have spent a lot of time on. It's been a moving target. And I'm sure a lot of you read how at first surrogate, you know, any expected mother was being required in some hospitals to deliver completely on her own. And we are very happy that we've moved to a point where the surrogate is getting a support person, the baby's getting a support person. And so we've actually moved miles, and we stay totally on top of this and then we actually, we have Carrie pre-register at the hospital, so it goes into her file and it's all there, and we ask for a room for the kind of dad with the baby. And so, yeah, we try to, our whole goal is to make everything go as smoothly as possible, as happy as possible, and also legal and ethical. So, you know, every step that can happen, we try. But, you know, obviously COVID presents new challenges, and that's part of what you're hearing. And Carrie, I mean, you did this whole journey without COVID. So except for what you've just talked about, have there otherwise been any big differences between this journey and your last journey?
I would mainly say the travel restrictions. You know, so there was a point where we were worried the intended father wasn't going to be able to make it out here, and then
yeah, we had lots and lots. He was like our email correspondent every day.
Yes, and I was so grateful. I'm so grateful that he's here. My family is too. My children adore him. But I mean, there was a point where we weren't sure if he was going to be able to be here, and he was able to get an expedited visa, and he's been here for a couple of weeks. But just, you know, I mean, that was definitely an added stress that we hadn't, you know, originally predicted. Right. And he had originally planned on being, I mean, he had like 30 family members coming out originally, and now it's just him, you know, so it's a lot different, but we're flexible, we're adaptable, you know. We told him our family will be here to support him no matter what, how much, you know, support he needs with the baby. And, you know, I had international IPs with my first journey as well, and they were out here all the time visiting, obviously with no travel restrictions or anything. So I would say that's been the main difference. And then also, when my previous IPs were here, they were able to come to all of the appointments during these last few weeks, whereas my current intended father can just come to an ultrasound.
Okay.
So,
yeah. So what tips would you give to a new surrogate, or to who's just navigating a surrogacy journey, or to someone who's thinking about a surrogacy journey, since you are now, you know, have this experience?
I would say, though my journeys have been different, I would highly, highly recommend it. For me, it's just been a life-changing, both of them have been life-changing events. And to be a part of making someone's dream of becoming a parent come true, I don't know, it's indescribable. I have this memory of when I had my first surrogate baby, and the intended parents were bonding with her, and my OB said, look, you have to look behind you. Look, this is because of you. Like, you helped create this. And obviously it wasn't just me, but to be a part of that, like, is just the most incredible, overwhelming in a good way feeling. And I would just say too, like if people were feeling, potential candidates were feeling nervous, with COVID going on, to reach out to other gestational carriers. There's Creative Family Connections has a great Facebook group, which is a great resource, or other, I'm guessing there's other groups on social media or online that you could reach out to. Reaching out if you have a case manager or your doctor. These are all people who've been just invaluable to me, great resources, and they've got the expertise. And also just to be like patient, flexible, understanding. I think those are qualities you need anyway in the journey, and just to be even more so now as we're all navigating this world that we're, it's all new to us and we're all figuring it out. And just in the end, like, it's so worth it. I mean, it's so incredible and absolutely worth it. So
oh, well, those are really,
we love you.
I love you too.
those are such great comments, and I really do believe that you are our, in the world of surrogacy, you are our frontline responders, and without surrogates like you, we couldn't create the families that we create. And so the fact that you keep doing this and continue to do it even in these very unusual times is just remarkably wonderful and fantastic. So thank you for, not just on behalf of the parents you've done it for, but really on behalf of everyone. Thank you. And you have been so generous in your time in talking to prospective surrogates who wanted to talk to someone who's been through it, and giving forward in that way. So it's been really great. So thank you, Carrie, for all that. So
you're welcome. Yeah. And thank you to you. You've been an incredible agency to work for, and I've loved working with Dr. D as well. And it's been, nothing but an incredible experience. So I'm grateful to all of you as well.
Oh, I'm so happy. That's really.
I just wanted to say a few words, and that was that, Carrie, I salute you on behalf of all future parents.
Oh, thank you. Thank you. I appreciate that.
That's a really, really nice way to put it. I second that. So, yeah. So on behalf of parents, let's turn to our parent on the panel, Justin Bernstein. He lives in DC, and like Carrie, he and his husband David started out on a journey in the pre-COVID world, and then had to pivot without warning to a COVID world with its many restrictions. So Justin, can you talk to everyone a little bit about how everything changed and how that changed on you? And
yeah, well, first, before I start, thank you for having me on the panel. And Carrie, you were not my surrogate, but you clearly embody all of the wonderful characteristics that our surrogate Michelle has. And I thank you so much, and all the surrogates out there, for what you do for families. It's incredible. So I'd say the biggest change for us was that we wanted our surrogate to be within one flight away from us so that we could go to appointments as much as we wanted to. Our surrogate is in Phoenix, so DC is a hub for American, Phoenix is a hub for American. We were popping to Arizona about like every 4 weeks. And so we had actually been out to Arizona for an appointment in February, and we're planning to go again in March. And all of a sudden we couldn't go. So I'd say the biggest thing was just all of a sudden not having free, access to actually physically be there. But thanks to technology and our surrogate and her amazing family, we were really able to be there virtually for as many appointments as our schedules would allow. So that was really great. And the other thing that was a challenge was with the birth. Our surrogate was having a C-section, so we knew that there were going to be challenges already with us all being able to be present for the birth because of all of the medical restrictions. And so we were at one point under the impression that neither my husband or myself were going to be able to even be in the hospital let alone in the operating room. So that was really, really hard. And then we found out that one of us would be able to be there and not the other. And so that was also hard. We had to decide who was going to get to be the one. And I wanted to be David because he had less experience with babies and I wanted him to get all the nurse training, and he wanted it to be me. So that was kind of a battle. But the birth plan process was another thing that I point out. So we had a birth plan before COVID, which was all great. We were going to all be in the hospital and everything was going to be wonderful. And then COVID happened. And so they had to write all these things into the birth plan. And my husband called a meeting with everyone. Diane was there. I don't think Niki was there, but our case manager felt like there were like 50 people on the call. And we were like, what are we going to do? We need to know, like, we need to have it in writing that we're all going to be there. And Diane was like, just go in with an open mind, be as calm as you can be, try to appeal to people's being human beings, and you'll be surprised at what happens. And that's exactly what ended up happening. We went to Arizona. I was prepared. Literally, I was telling my family and friends, like, I might be in jail because I'm going to be like fighting to get into the hospital. But when we got there, everyone knew we were coming. They knew our situation. They were all super excited for us. The head nurse for the ward actually had done a surrogacy as her very first delivery, like 25 years ago. So she also felt like a personal bond with us because it was kind of coming full circle. So once we were in the hospital, we were sitting in a waiting area, just like the public waiting room for the maternity ward. And she comes by and she's like, oh, you guys, let me get you a room. So she gave us a private room. And we were able to have free access to our surrogate after the delivery. And we all stayed there in the hospital for the night. They wheeled out the baby from the operating room too, so that we could cut the umbilical cord, which was really cool. It's a lot bigger than I expected it to be. And not as like disgusting looking as I thought it would be. But it ended up being a really beautiful experience. And I think the thing that I learned the most from it is, yes, you can prepare for the worst, but people are people, and especially people who are in the business of bringing babies into the world, they are like the most compassionate people. So if they're able to, they're really going to do what they can to try to make it work for you. But again, the goal is to keep everybody safe and healthy. So, you know, of course, you need to do what needs to be done to keep everyone safe. But even like reading back the birth plan now and knowing what actually happened, it's like, yes, that's what they said in the birth plan, but in actuality, it was much more like I thought it was going to be in the beginning. Than anything else. Mostly the biggest difference is that we were all wearing masks. But even in the hospital, in our own room, we could take our masks off and, you know, bond with the baby freely.
Yeah, that was great. And back at Creative Family Connections, we were all cheering when we heard that they both got in because we knew.
I'm glad you had to bail me out of jail.
Oh yeah, no, we knew how much they both wanted to be there, and yeah, I really did say just walk in like you know what you're doing, and you'll be surprised how many times you can just walk right in, and it worked. So we were really happy, and I did love Justin's story of because I said, so how'd you decide who should go in, and he was like, well, I wanted him to go in, he wanted me to go in, and how did you decide in the end?
He really wanted me to go in, and so I just decided not to pick that battle. But I think in the back of my mind, I knew it was going to all work out. I just didn't know how much drama there would be in getting it to work out. But it ended up being like so easy.
Yeah, that's always
I hope
the best.
everyone else had that experience.
That's what we always hope.
I have to tell you, Justin, I wasn't on that call, but I'm born and raised Arizonan. And moved from Arizona 5 years ago, actually headed back. But Diane did text me and say, do you have any connections at this hospital? And I'm like, well,
we were gonna do everything we could, believe me.
Everything. I can promise you that much. I was like, wait a second, what's going on? So I wasn't on the call, but she was hitting every area.
I did not know that, but it does not surprise me. You all are so great at using all of your resources to advocate. So I really.
So, Justin, so what would you say to parents who are considering pursuing a journey at this time? You know, given that you started off before, ended up with in COVID, do you have specific suggestions to them about pursuing a surrogacy journey during COVID? Do you have suggestions or tips for them about pursuing a journey in general? You know,
Yeah. So in general, and I actually have a friend who's listening in, and so she can probably attest to this too. I've always said to people, the second you think you want to do it, start, because it takes a lot longer than you think. So, and you can always slow things down. You can't really speed things up. And especially in this time of COVID, there's a lot of other things that might end up slowing you down. So if you really do want to do it, I would suggest like starting down the path of the journey, because you could always, pump the brakes if you feel like you need to. I was actually listening to this whole panel thinking about myself, and if I was going to go through a journey again, how would this information help me? And I have to say that all of the medical advice that Dr. D provided really made me think about how helpful that freezing your sperm and sending it all over the world would be before COVID. But I'd say it seems like it's still pretty safe to do. You just have to go in with a lot of like flexibility and openness, like Carrie said, because things are going to be thrown at you no matter what. Even in a non-COVID world, things pop up, and you just have to be ready for that and have a plan of how you're going to get through it without, feeling like the whole thing is getting messed up or feeling like you're not going to get to the end goal, because you really are. It's just there's lots of little things that, you have to get through to make it all work. But in the end, and I wish I had my daughter here, she's taking a nap now, but it's so incredibly worth it. And all of that stuff that you went through, it's like you forget that it even happened. So I would say if you're ready to do it, go for it.
that's great advice. And what I would say is, I mean, you're looking for somebody, when you're looking for an agency, you're looking for someone, an entity that you feel you can trust. Because there's a lot of trust in a surrogacy journey. So you're looking for an agency that you trust to take you through this journey, and that you trust to find you a surrogate that you're going to be able to trust. And the same thing with your clinic, because you're putting there was no class in this when you were growing up how to do a surrogacy journey. So you're relying on people who hopefully are going to be experts and that you just have a rapport with. So there's a certain amount of gut instinct in choosing, but then also experience. So because you want to feel that, because there could be medical bumps, there could be other bumps in the road, and you want to feel like everybody's doing everything they can to help you, sort of as Justin said. When there were these things going on at the hospital, at least he knew we were all trying to do everything for him. So yeah, well, the panel, I think you have been so amazing, and you're not done yet because we have lots of questions, but it's been really, I think all of your statements have been inspirational. And why don't we turn to some of the questions that have come in? There are two questions with respect to the COVID vaccine. So these would be for Dr. D. One is a short one. When there's a COVID vaccine, do you recommend that pregnant women get it? Could it put the fetus at risk? If you want to answer the short one, the long one came into me ahead of time, and I will get that one out a little longer. So go ahead and answer the short one first.
Yeah, I do believe that pregnant patients should get the COVID vaccine, much like, for example, with the flu vaccine. It's something that's recommended for pregnant patients, specifically for pregnant patients. So many of the techniques and the platforms, the leading companies are using to develop this vaccine is similar to the ones that they have before. And the reason why some companies are farther ahead than others in regards to development of the vaccine is because some of the companies have already had experience. For example, the Oxford group has had experience with the Ebola virus. Moderna, which is another company that is actually creating a very novel vaccine, they've also had experience with other viruses as well. So the companies that are farther ahead had platforms already in place for previous viruses. They had been tested already. Clinical trials had been done. They had been deemed to be safe. And now they're applying the same platform to a different virus. It's important to note that if you look at the DNA sequence of this particular virus, it shares 82% of its DNA sequence with the previous SARS virus. So many of the viruses are actually fairly closely related, and so I do believe yes. It's a long answer to a short question.
Yeah, I actually was very optimistic by your answer before in your presentation that you thought we might have a vaccine by, I guess you said late fall.
I think so. I think, and it's for example, Dr. Fauci at the NIH believes also that by late this year, we'll have the first probably a few vaccines, and then early next year, other companies will come, because we're going to probably have well over 10, 15, 20 different types of vaccines, because there's a sort of a race between all of these academic universities and private companies for the development of the vaccine. That's why I'm so hopeful, because there's never been a time in history where so many researchers, some of the greatest minds in the world, have been laser focused on development of this one vaccine for the coronavirus.
Right. So the person who wrote me this question, then his factual assumptions may be incorrect. He said, I'm a single father hoping to do another journey with a surrogate who delivered my daughter in February. We're hoping to schedule an embryo transfer for November or December. The surrogate has made it clear she will not get a COVID vaccine should one exist while she's pregnant. I, on the other hand, don't want to proceed with anyone who won't get the vaccine. Of course, the vaccine will likely not be ready by November, and don't know if it will be available throughout the course of such a pregnancy. I'd hate to not move forward again with this amazing woman if it's unlikely a vaccine will be ready or advised for pregnant women. She'd be scheduled to give birth in July or August 2021, which would leads me to two questions. First, would it be available to pregnant women, which you just answered, because of the no testing on pregnant women, and would that impact, whether it would be advisable to pregnant women? And second, if a pregnant woman does not want to get the vaccine, or if it's advised that pregnant women generally refrain from getting the vaccine, will she and the unborn child still benefit if others around her in her family, social circle, workplace, and community start getting the vaccine?
That second part of that question is what the important part is, and that is that the approach to any particular viral pandemic is to develop immunity. To develop immunity in the community to an extent that you can essentially make a significant dent in the onset of new infections. And most epidemiologists think that that level is somewhere around 60%. If we can get 60% of the population either immune from previous infection when they develop immunity, or from a vaccination, then we have a significant impact on the further spread of the virus. So even if your surrogate decides, and by the way, your surrogate is going to be a lower risk population, because she's younger, she's healthy, she's going to get screened to make sure that she's healthy before another pregnancy. Obviously, all clinics, have very stringent screening parameters. So she's going to be low risk, even if she decides not to have the vaccine, which is her right. I think that by virtue of the fact that we'll have a vaccine available, that will help.
Okay, I think that's a helpful answer for him. There's another question for you from a intended parent whose surrogate is in the early phases of the journey. Do we put our surrogates and other people at risk through travel, airports, and other crowded places? And do you have any recommendations to minimize?
I do think that the travel has changed for everyone. I mean, we have surrogates coming in now and traveling by plane, from different states, for screening for embryo transfers. And when you ask them, how was your experience? It's a very different experience. First of all, the airports are not as busy. They have probably about a third of the busyness as they used to have. Number two, everybody's wearing a mask at the airports. In the airlines are not. Everyone has to. It's mandatory to wear a mask. The surfaces are sanitized. There's no services in terms of drinks and food and everything that could potentially be a source of contamination. So I do think the risk is actually very low. And when you look at the studies that have been done on the spread of the virus, it actually hasn't been from travel. 80% of the infections that we see are from what we call sort of super spreader events, meaning that a larger gathering of people where they're not careful, they're not wearing masks, there's sort of close interaction. And those particular patients end up becoming positive and then sort of spreading it to others. 20% are sort of these other types of interactions. 80% are these sort of larger gatherings. And that's why I think that the sort of the last things to come back in terms of if we don't have a vaccine are these larger concerts, gatherings. Unfortunately, I'm a big sports fan, and so I don't think I'll be watching a sporting event for a little while, except on TV.
Unless they have no fans, right?
So that's why I'm rooting for the vaccine. And on my Facebook page, for example, I've given some updates on vaccine development and where we're at and who's farther ahead. And it's a really fascinating subject. And it's for me as somebody who's really loves the science, from the days when I was in medical school. I think it's just brilliant what these researchers and great minds around the world are doing in terms of developing the vaccine as quickly as possible.
Yeah. So one of our listeners asked if there's not a vaccine, or I guess you could also say until there's a vaccine, what protocols are put into place to protect the surrogate while pregnant? Could the surrogacy agreement address these protocols? Would the agreement increase her fee due to these additional limitations? So I think I talked a little bit about the fact that we have some general, because it's changing so much too, to talk about, following guidelines, masks, social distancing, following whatever the local and CDC guidelines are. But we have not increased our fees due to COVID. Carrie, do you want to speak to any particular protocols in your day-to-day life that you feel are different?
I mean, there are definitely things that are different, but it's been fine adhering to those. And again, it's just some of the things we've talked about where I ended up working from home starting in mid-March. I'm an elementary school teacher, and it was interesting to teach from home and then teach my own children who were home. And but
that would have been regardless of your pregnancy, though.
Right? Oh, absolutely. Right. And so, I mean, I was able to stay home more than I normally would have, and just went out to get either like necessities or go to OB appointments. And again, just while I'm out, just being extra diligent about washing my hands, using hand sanitizer, wearing a mask, keeping social distance, and just being smart in my day-to-day life about not getting together in large crowds. And it's definitely been a change and a difference for me, for my family. But I mean, not that inconvenient in the whole scheme of things, I mean, of course, I'd be willing to do it and do everything I could just to have a safe pregnancy, and even more so that with someone else's child than my own, so, but nothing that's been that inconvenient. It's all seemed worth it and reasonable, and nothing that I wouldn't not do. So
yeah. Justin, did you ever have any worries about your surrogate during the the point where from March onward in terms of what she was or wasn't doing because COVID was in place?
I did not. And, I think I think there's something about women who are willing to be surrogates for other people that, kind of like Carrie said, they're carrying someone else's child. They're like extra attentive to, what needs to happen to make it be a safe pregnancy. And, I felt like our surrogate was our baby was in Fort Knox, basically. Her whole family, as soon as the shutdown happened, they're in Arizona. So, things were a lot more lax there, I would say, compared to the East Coast. But they were really kind of following what we were doing even before it was required in Arizona. So they were all wearing masks. They were, really not going out to the store at all unless it was absolutely necessary. And, all of that was without us ever needing to say anything. So I felt very, very safe.
Yeah. And I can tell you that I hear this about our surrogates all the time where they're saying, Niki can probably speak to this as well, where they say, oh, I took such good care of myself when I was pregnant with my own children. I'm going to take even better care of myself because it's someone else's. So the level
Absolutely.
of, yeah.
I definitely think that's a fair statement and very accurate, and we ask before we even go forward with the matching process, what are you doing? What are your COVID-19 precautions? If you work outside of the home, how are you taking care of yourself to make sure that everybody's wearing a mask and washing their hands diligently and using sanitizer, to do our best to make sure that your surrogate is, taking care of herself and taking those additional precautions before you're even matched. So yeah, they definitely, what pregnant women take good care of themselves. It's a little different when you're pregnant with someone else's baby. You're like, okay, like Justin said, Fort Knox.
And Niki was a surrogate too, so before she started working in the
with twins, and that's a whole new ball game. But I like to think I was like Fort Knox, so I tried.
So Justin, here's one for you. One of our listeners is interested in how you traveled back with your daughter from Arizona. Did you fly? Did you drive? How did you get home?
Travel was definitely a stressor. So when all of the things started shutting down, we were thinking through literally every possible conveyance that could get us to Arizona and back. We looked into private plane. We looked into an RV with a driver who could get us there and back. We didn't want to have to drive ourselves and stop and have more exposure. So we were really trying to find every way to make it happen. We ended up flying commercially as we had planned. There were, on the way back from Arizona, I think there were 19 people total, including Olivia on the plane, our daughter. It was pretty much like flying private. Everyone had masks, and we just had her in the carrier and had her covered with a swaddle. She really did not get exposed at all to anyone, and we just got on the plane last so that we didn't have to have people walking by us all the time, and we splurged to fly first class. So it was actually pretty safe. I'd say the biggest stressor was just like all of the stuff that has to come, but that happens no matter whether there's COVID or not. But especially with all the extra precautions of COVID, I would plan to try to bring more stuff than you maybe normally would in terms of like cleaning supplies and all that stuff if you do need to go travel and come back with the baby. But we were able to leave within 4 days of her birth. So it was pretty quick.
Okay. Well, someone else had a very similar question, which is what protocols should be followed after the birth of the baby to ensure they are kept safe? And I assume that means not only with respect to traveling, but also where you stay in the local area. So I'd be interested in your comments on that, Justin, but also maybe Dr. D, you might have a comment on that too.
Sure. So we stayed in like a timeshare kind of hotel. So it had a kitchen and all that stuff because again, there's lots of stuff and you need a lot of equipment for a baby. And I came equipped with probably 3 canisters of Clorox wipes and different cleaners. And even though I think there were 2 other families staying at this whole hotel complex, before we put anything in the room, I just went through and just wiped every single surface down just to make doubly sure that it was clean. And then they offered a cleaning service to come in once a day if you wanted, but I opted not to do that and just did it myself so that there wouldn't be an additional exposure of a person into the unit. We got groceries and just wiped everything down and made sure it was all, clean. We got disposable everything. We didn't use any of the, plates or anything that were provided by the hotel. And we had lots of masks on hand. And it worked out pretty well, lots of hand sanitizer. And we just went from hotel to hospital to hotel. And occasionally we would take a walk around the mall that was completely closed and there was nobody there. So yeah, just avoiding as many people as possible, which I know when you're having a baby is like the opposite of what you want to do because you just want to share the experience with everyone. And we were supposed to have our whole families out there with us, and it was really just us. And so that made it a different experience, but thankfully there's technology so everyone could Zoom in at the hospital too.
Okay.
Yeah, I think really Justin broke down all the precautions that you take, as a parent for your child. If you look at the recent studies that have been done on the transmission of the virus, the rate of transmission from objects, touching objects is still fairly low. The majority of the infections and transmissions are from person to person, and it's close contact from person to person. But I think you have to be extra cautious, and everything that Justin outlined is exactly what I would recommend. I mean, they did it to the T. They were careful. They avoided, spaces with, larger gatherings. They wore masks, and they limited the number of people who'd come to the room so there was no introduction of more viruses. I think it was it's a perfect protocol for protecting your newborn.
Yeah, excellent answer. Thank you for sharing that experience. So one of our intended parents from the UK has asked whether insurance has become much more expensive. So I'm not sure if this refers to the surrogates insurance or newborn insurance. And the short answer from my experience is that we haven't seen an uptick in either insurance specific to COVID, thank goodness. And obviously in general, over the years, there has been a general uptick in insurance in general, but I haven't seen typically insurance rates are set per calendar year. And so we haven't seen any all of a sudden adjustments since March that I've noticed. We've actually seen some new rollouts of plans that are a little more competitive. We saw one on the newborn side. So far, so good. And maybe that also goes to the fact that what Dr. Daneshmand was saying, which is that the population of surrogates isn't particularly a risk, and neither is the population of babies. So, those are usually based on actual cases. So, in terms of the data, that would support that. Okay, let's see. So I think we covered measures for traveling with the baby, right? You talked about what you did on the plane as well, Justin, and on also, yeah. Okay, so some places in Europe recommend that you work from home. That's also true here, and limit how much you go out. Are there any specific risks at the end of a pregnancy? So medically, are there more risks? You know, like in some things, like there are always medicines that they say don't take it, they're in the third trimester. So is there any more risk at the end of the pregnancy to going out than any other time, Dr. Daneshmand?
Not really. I mean, you know, if any type of infection that can cause high fevers and other types of symptoms, you know, for example, let's say if somebody were to get COVID-19 and they were pregnant and they had high fevers or they had pneumonia and complications from it, severe complications, whether it's from the flu or the coronavirus or any other type of infection, that can increase in the first trimester the risk of miscarriage. And in the third trimester, potentially could increase the risk of premature birth. But again, the majority of patients who are pregnant, even if they were exposed and if they were positive for COVID-19, the risks, they have either mild symptoms or no symptoms at all. And again, these are based on studies that have been done. Pregnant patients tend to be a young population, and especially for surrogates, they tend to be screened before they, you know, move on with the embryo transfer in pregnancy. They also have had previous healthy pregnancies. That's one of the major prerequisites of being a surrogate. So I feel, based on research, based on studies, publications, the risks are very limited. But again, as you said, Diane, following the CDC guidelines, following also your local guidelines are the best way. And they can change from time to time.
Right.
Following those. And I think really Justin to sort of cautionary words, but also advice for parents prior, you know, to get kind of preparation for the birth, and then also for the newborn as well, in terms of protecting your newborn.
Yeah. And to that end, one member of our audience has asked, because you seem so well prepared, Justin, if you have a list of the items that you brought with you, if you would be willing to share that list, and then we can distribute it to the people in our audience, because people are very impressed that you were so well prepared.
I can see. I can't remember if I have all of the cleaning supplies and like COVID things on my spreadsheet, but I do have a spreadsheet, and I'll make sure that Diane and the team get it. And yeah, I cobbled it together from lots of internet resources, so you're welcome to use it.
That would be wonderful. And yeah, you can always just say COVID cleaning supplies. So someone also asked whether Carrie had to travel by plane for any of your frozen embryo transfers. Those would have probably been pre-COVID. And also whether you got pregnant after your first transfer.
So I did travel back for this current pregnancy. It was back in September for the embryo transfer. So I live in Oregon and flew down to Southern California in San Diego for the transfer. And we were there for a couple of days and then flew back. And so do I go back to my original transfer as well, as far as answering the second part of the question?
Mm-hmm.
Okay. And then with my first surrogacy journey, I did get pregnant on my first transfer. And then with this journey, did not get pregnant on the first transfer, and then 6 weeks later did. And it's been great, easy, uneventful. A great pregnancy.
Yeah, which is also great to know that, you know, sometimes you're just on the wrong side of statistics. It doesn't mean there's anything wrong with anything, and it just takes another try. So
sure. And I mean, at the time, I was surprised. I'd never had, my husband and I decided we wanted to have kids, and we had kids. And then I decided I wanted to be a surrogate. And the first time, the first transfer took. And it was really helpful, though, talking with Dr. D afterwards, after the first transfer for this intended father didn't take. And he was just really reassuring, and we felt really confident going in 6 weeks later. And again, it's been wonderful. So
Good, good. So the same person wants to know the same question has the same question for you, Justin, about your surrogate. Did she travel by plane for her transfer, and did she get pregnant after her first transfer attempt?
So yes, she did travel by plane, and it was pre-COVID. I believe it was in August that we did the transfer. And she did get pregnant on the first transfer. However, there was a previous attempt. We were preparing for a transfer, but the lining didn't get to the proper thickness. And so we had to kind of go back, and she had to do some protocols again and get it to the right thickness, which of course at the time was devastating, and we just wanted it to happen. But I think it was probably 6 weeks later too. We got pregnant first try, and it was perfect. So going back to what I said earlier, just prepare yourself for those little bumps, and don't let one thing get you down. You just have to keep pushing forward.
I would agree with that too. And at the time I reached out to our Facebook group of other gestational carriers. And I remember one other surrogate saying like, oh, that happened with us. And it became kind of like a blip in our rearview mirror. And we're on our, now we're into, so many months into our journey. And it's hard to even remember that happened.
Yeah, that's a really, a great way to look at it. So we have one other question, and we have about 2 minutes left. So let's see if we can fit this one in. What can you do if you see an increase in COVID in the area where your surrogate lives, and you don't feel that the local restrictions in that place are strong enough? Again, the contract is going to say CDC guidelines or local restrictions, whichever are stricter. And the CDC guidelines speak about social distancing, about wearing masks in public, about not being in big groups. I mean, Dr. Fauci is on the news as often as they'll let him, saying don't get in crowds. That kind of overrides the fact that local ones go up and down. And we purposely wrote the agreement that way because we knew that it was an ever-changing picture up and down. But honestly, I think that we've never seen a surrogate push those limits. And so I think what I would recommend if you're worried is to come to your case manager, because certainly what we always tell clients is you're her cheerleader. You let us be the bad cops. If you think that there's something that needs to be told in a sterner fashion, let us do it. That's our job. And you just be her cheerleader. So that would be my suggestion. But yeah, some of the states have not been very strict, and so in those cases we would definitely say they should be following the CDC guidelines, and hopefully that's what's happening. And if you have any reason to think that something else is happening, then you absolutely should reach out and talk to us. And we'll hatch a plan, and we never rat out the parents and say, oh, so-and-so said to us. It's very easy to, make it come from us. So that's our job. This, I think, has been a really fantastic panel. I want to thank all of you, Dr. Daneshmand, Niki from the CFC team, our new parent, Justin Bernstein, and our surrogate, Carrie Jordan. Thank you all so much for spending your time and speaking with all these parents. We hope that you found this helpful. And with that, I wish you all a great rest of your day or evening. And thank you so much.
Thank you.
All right, thank you so much.
Bye.
Thank you.